Well, what we feel is that the primary care centres should be the centre for primary care in our local communities, and they should be fully staffed to include speech and language therapists, to include physiotherapists, and all that goes with a proper primary care centre. Unfortunately, the figures that we're looking at show that the HSE haven't designated additional staff for these centres, so they're going to be nothing more than glorified GP surgeries. Now, while we absolutely value the work of GPs in the community, we do feel that the ancillary services necessary to support a fully functioning primary care team need to be targeted, need to be resourced, and the HSE have to have a plan.
But you could argue that even if these services aren't available at the outset, these primary care centres will evolve over time.
Oh, we don't believe that. We believe that unfortunately what will happen will be the centres will gradually shut down and become unused. What actually needs to happen is they need to be fully staffed immediately or as soon as possible, and also we need to have a plan. That's our concern. Our concern is when we look at the figures released by the HSE that there are no staff designated, no additional staff. If I take my own constituency of Dublin Fingal, Balbriggan, we have a beautiful new primary care centre being built at the moment. When we asked the HSE how many people are going to be working in it, how many additional staff are going to be supplied for North County Dublin, the figure was 0, and that's not acceptable.